Hi guys, welcome back to my channel. It's been a while since I last made any videos, and if you're following me on Instagram, you know that I am currently in 37 weeks and I'm feeling tired by the day, barely have energy to do anything, but I've gotten a lot of messages on my Instagram asking me how am I preparing for birth and if there are any resources that I'm using since family is not gonna be coming. So I decided to come here and talk to you guys about the prenatal classes that Kazi and I took back in January, which was for 5 weeks, and the things we learned in our prenatal classes. So grab your coffee because this is going to be a little bit detailed session of the 5 classes which I'll be talking about. Let's get started. So the classes were provided by our clinic, South Health Maternity, and thankfully at that time it was an in-person class, so we actually went in to do these classes. Now the classes costed around $380 and it comes with a support person, so the mother and the support person can go to the class together. There were about 7 couples and everybody took their husbands to their class. So it's best if you have never given birth before, you have no family around, and just like me, you are gonna be a first-time mom and you're preparing everything all by yourself. This is a great opportunity to learn about how labor works, how to deliver, what are the things you should expect, and it's best if you bring your support person. My support person is Kazi, since he's going to be there in birth, and it's very important to get your partners there because they need to understand what you're going through during birth and how they can help you and maximize your comfort level and make it a better experience for the both of you. So in the first class, we just touched the basics. So it was like introduction of the female anatomy and what happens when you conceive, and we also talk about how when you are growing your baby, your organs get suffocated, so they just start piling up one over the other, and that's why you have heartburn, you have to go to the washroom all the time, and things like that. It was pretty basic. It was introducing your couples that day and how many weeks we're due, what are we having, and if we found out the gender or not. And it was mainly like interacting with the different couples in the class and also with the registered nurse who is doing these sessions. And then we go on to week 2 and week 3. Now each of these classes are 2.5 hours long and they did get very detailed with us. Of course, I'm not going to tell you everything what we did in 2.5 hours. I do need probably hours of explaining that, but I'll try my best to give you a summary of how it went. So in week 2, we were introduced to labor and what to expect during labor. Now, me being a pharmacist from back home, I kind of knew a lot of things going into this session, but this session really helped Kazi a lot because he literally had no idea about labor, things you need to prepare for during labor. So it was really interactive for him to know more about these topics. And if you are not from healthcare profession background and you have not studied science in details, this is a great course for you because you'll be learning a lot. So there are 3 stages of labor: early labor, active labor, and then transitioning. So during early labor, this happens mostly at home. So you can have mild cramps and contractions days before your birth, and early labors are 30 to 45 seconds long and they can happen anytime between 5 to 30 minutes apart. So when you know that you are in early labor, you're gonna have mild contractions. The pain is mostly bearable, and early labor means that you can be 1 centimeter, 2 centimeter, or 3 centimeter dilated, and it can even happen for days before you give birth. So when you're in early labor, the hospital doesn't take you in. So even if you feel like you are in pain over here, and you decide to go to the maternity triage to get checked, they don't really take you in. They're just gonna check if you are dilated at least above 5 centimeter for you to be admitted into the hospital. If you're dilated less than 5, they're gonna do an internal vaginal exam or a cervical check, and they're going to find out how much dilated you are. If you are below 5 centimeter dilated, they're gonna send you back home, and they think that it's best if you labor at home, a more relaxing atmosphere, so you can relax and be comfortable compared to hospitals which freak a lot of the women out and they feel like they're being pressured, so they don't really take the patients in during early labor. And then active labor happens when the dilation is about 6 centimeter and above. So 6 to 8 is known as active labor, and they last for 45 to 60 seconds, and they are closer, so that's 3 to 5 minutes apart, which means that you are currently in active labor. It is not necessarily that your water is going to break. As we see in the movies, the water breaks all the time, and then the girls, they rush to the hospitals, which is not true for the real labor. Actually, most women don't even have their water broken until they go to the hospital, and then the doctors need to do it artificially for them. It doesn't break on their own, and a very small percentage of women actually has their water broken at home. So it's not like the movies, and you definitely don't know if you are in active labor until the timing is 3 to 5 minutes apart and it lasts for 45 to 60 minutes long. You know that it's been happening for over an hour. You know that you need to go and get yourself checked. So once you're in active labor, they admit you to the hospital and they start checking you and monitoring you, and by now you should obviously have your hospital bags packed because it's go time. It can happen anytime. And then comes the transitioning, which is when you reach 10 centimeters. So you are 10 centimeters dilated, which is the maximum you need to be to push out the baby. And transitioning lasts for about 1 to 2 hours, and within this 1 to 2 hours you start pushing, and it can take up to 2 hours for you to push, and the baby comes out eventually, which is what we want. This were the steps of labor. And then they talked about the positions of labor. So we as couples were given exercises in the classroom. So we had to try these exercises with our partners, and we tried out the different positions of labor, such as slow dancing, where you move your hips with your partner to relieve the pain, and then you do squatting, you do curbside walking, where you walk against the curb, and then you try to manage your pain and make sure that you are having contractions, but you are also actively making your labor go faster so that the time takes less. And then there was this other position where you do side lying, you lie on the bed and you turn to your sides, and then you stretch over there so that the baby's position can get lower, and this can help you also decrease the time for active labor. We also tried other different methods like massaging, where your spouse needs to massage the lower back so that you feel comfort and it doesn't really hurt you much, but it also gives you some comfort and you feel better because the pressure is going to be very low and a lot down there. And I'm already having these pressures, so whenever I'm having these pressures now, Kaz is actually massaging my lower back because the baby has dropped to my pelvis, and the doctor said that the baby is gonna drop even lower, so the pressure is all in the pelvis region and you do need all the support you can get. The important thing that I learned in this class was my option for pain medications and how to advocate for myself and have the best resources available given the time comes, and to know what I'm going through instead of just flying in the blind, which is very important because I think knowledge is power, and if I know what I'm going through, I am prepared mentally from before about what to expect. Obviously, giving birth is never easy and the pain is inevitable, but you can work around your options to see what pain medications work best for you, and you can advocate for yourself when the time comes. Now, as you guys may or may not know, if you are a first-time mom, you always go above the due date, so you don't normally actually give birth during the 40 weeks. It's rare. It's like you do expect yourself to go above the 40-week mark, and I am expecting that I will be going over my due date. And it's very important to know that if you're going above your due date, the doctors here are not going to induce you. That means they are not going to force start your labor, especially if you are having a healthy pregnancy, until you are 41 weeks. So a lot of the moms don't know that, and then they start getting fidgety when they're 37 weeks and they feel like, when is the baby coming? I can't wait anymore. Why isn't the doctor doing anything about it? But in North America, they're not gonna do anything about it, especially if you're having a healthy pregnancy with little or no complications. They're gonna wait until 41 weeks until they induce you. And there are quite a few methods of induction, so they do give you options in things in the pain medications which you can use for inductions, and these are mechanical dilators. So they insert something called a Foley bulb inside your cervix, so it's gonna cause your cervix to ripen. It's gonna make sure that your cervix is expanded so that you can start going into labor if you haven't already started, and this will increase your dilation and get you to active labor. And then there are other methods, like the doctor can perform a internal exam, also known as a cervical check, where they will strip your membranes. So they're gonna strip the bag of waters from your uterus so that your uterus starts contracting and cramping, and this can put you into labor. Now, this is not as effective and it can be painful, but it depends from woman to woman. For some women it has worked, and for some women it doesn't work, and doctors ask you if you want this cervical check done from your 38th week of pregnancy. So you can get it, but it's optional. You have the right to reject cervical checks and wait until 41 weeks to actually be induced if you don't go into labor naturally. So I think I'm gonna refuse these checks because I don't think that I am in a hurry right now to have the child. I think the child will decide when the child wants to come to the world, inshallah. So I'm just gonna wait, and I'm not gonna get internal cervical check done, but this is an option if you want to induce your labor and kickstart the labor. Then there are cervical ripening agents. So they either put a pill on your vagina or they give you something orally, and this will cause contractions and again kickstart the labor. And then they also have this thing called Pitocin, which is a synthetic hormone which mimics oxytocin, which is the love hormone, and this can cause contractions. But the problem with this is that it is a narcotic, so it is gonna be administered through you intravenously. So there's gonna be a pipe and it's gonna be connected to your wrists, and it can make you feel drowsy, and it can also make you feel more tired than usual and can increase the pain sensation a little bit more, but this effectively puts you in labor. So you do have the options to ask your doctor what you want when the time comes, and if you know the options from before, it's actually really great because you know what the nurse or the doctors are talking about, and you can advocate for yourself instantly. And as many of you know that we do also get epidural. So epidural is given in your spinal fluid, and this is given to reduce your pain and to numb it down there, so that you don't feel the contractions as much. And there are a lot of pros and cons about having an epidural. It's a personal choice really if you want to get it. Some women, they want to do everything naturally so they don't get epidurals. Some women, they don't want to feel so much pain, so they get the epidural. I personally think that it depends really on the situation. If the situation calls for it, then I will be getting it, but I'll wait and see. And mainly these were the things which we were taught in more detailed versions of it. We also had a cesarean birth demonstration where Kazi was actually the volunteer. He had to volunteer as the cesarean patient, and I was the support person in the class where I gave support to him while he gave birth. I think I actually have a picture somewhere. If I do, I'm gonna attach a picture on the screen where he was wearing the hospital gown. So it was really real. They were showing out a real scene of how a cesarean birth happens. Now, the nurses who were teaching us told us that cesarean birth can again happen at any time. So let's say you decided that you wanted to go for a vaginal birth, and obviously that's the best way to go through, because vaginal birth will prevent a lot of complications, and cesarean birth is essentially a surgery. So they actually cut you open to get the baby out. And it depends from woman to woman, but vaginal birth, even though it's longer and it's painful, but in the long run, it's like the recovery time is less. You can start walking within 2 to 3 days, and the pain is a lot less in recovery compared to cesarean birth. But cesarean birth can happen at any time. Let's say you are laboring and you decided that you wanted vaginal birth, but during your labor, somehow the baby's heart rate dropped really low, or the baby somehow changed positions and became breech. This can happen anytime during pregnancy, even during labor. And sometimes the baby is not in the right position to be pushed out from your vaginal canal, and this can be risky because it puts your baby in a position where anything can happen, and they decide the emergency C-section right there and right then. So you have to be mentally prepared that C-birth can happen at any time. And the reason they say it as C-birth instead of C-section is because any birth is beautiful. You are bringing your baby to this world. So it doesn't matter if you are doing it vaginally or if it's a C-birth or C-section. You are bringing your baby to the world. You did carry your baby for 9 months, and you are a warrior for doing that. So every birth is beautiful. A lot of the mothers, they feel like they haven't done their best, or they don't feel accomplished when they go into C-section, but that's not how it should be. You should be proud of yourself for even going through something so huge like this to bring your baby to the world. And this is the mindset that I am gonna have going into labor, that anything can happen, and I know that I am doing my best, and I did my best to bring the baby into the world properly and healthy is what I should be aiming for. And the best way for that to happen is to accept mentally that you don't have things under your control. Anything can happen. You know what to expect, and you should hope for the best. So when C-birth happens, this thing we didn't know is that it actually takes only about 20 minutes for the entire process to be done. So they take you to the emergency OR, they prep you in 5 minutes, 5 to 10 minutes, and then it takes approximately 10 minutes for them to actually do the surgery and have the baby come to this world. They're gonna be approximately a team of 10 members in C-birth. So there's gonna be 3 people in the NICU team who will be waiting in standby, and then there's gonna be the doctor and 3 more nurses with the doctor, and there's gonna be a backup team of nurses, approximately 2 to 3, who will be making sure that everything is okay once the baby is born and take the weight and temperature and everything like that. So it is a little crowded in the C-section room, which we didn't know at all. So they're gonna be approximately at least 10 members from the healthcare professional team, and then 1 support person and the person who's giving birth by themselves. So all this was really interesting to learn and acquire knowledge about, because it was an eye-opener for the both of us. I didn't know these details. Kazi didn't know anything at all, and it did really help him prepare what to expect during labor, because a lot of the men are clueless when it comes to labor. And if we are relating back to the olden generation, our fathers were probably not even there for our mothers in the delivery room, so our mothers had to do all this alone, and they didn't understand the pain our mothers went through. So this is really awesome that your partner is being able to understand what is happening to you and is educated in what to expect and how they can help you in best possible way. And then week 4 and week 5 was about postpartum and recovery, breastfeeding, and how to handle newborn baby. An important thing that we don't know about postpartum recovery, especially the men, is that women can go into postpartum depression or postpartum anxiety right after they give birth, and they're most vulnerable in the first 2 weeks of their life, and it can happen anytime within the year. Now, mental health is not often prioritized back in our countries, although I'm seeing that it's changing over the years, which is really great to see, and everyone's having a bigger and broader mindset about mental health. But you should be seeking help because you just gave birth. There's gonna be a lot of changes in your body. There's gonna be a lot of hormonal fluctuations, and it can get confusing in the first few weeks of your life when you don't really know what to expect. You're thrown into the unknown. There's little or no help, little or no sleep. So women tend to go into postpartum anxiety and depression, and they do need to talk to their support group. And over here they even have therapy for women who are going into labor and delivery, and I know that I'll be booking a few sessions with a therapist to talk about how I feel, just to make sure that I am mentally safe and I don't fall into postpartum anxiety or depression. And it really helps for your mental health as well to talk with a professional and to understand and navigate what's going on with you. Your partner, your support group should give you that ample support. They should be helping you around the house and understand that you just gave birth, so this is not easy. It's a huge thing. And you should also talk to your partner and have a postpartum plan. So if you haven't talked with your partner already, you should now, and make a postpartum plan about what to do. If you're feeling overwhelmed, you should communicate with your partner, let them know that you're feeling overwhelmed, and suggest ways to reduce your postpartum anxiety and depression. I've decided that we will try to go out for walks. I don't know how much possible it's gonna be since we'll be first-time parents, but I'll try my best to make sure that I am having a healthy mindset and trying my best to make use of all the resources that I have. And finally, we did the 5th class on newborns, where we learned about how to take care of newborns, how to do swaddling, how to change diapers, what to expect during baby's first bath. And it was very interesting. They got us those sample dolls, and we learned how to swaddle those babies and change diapers. This video was recorded about a couple weeks ago, and right the next day I went into labor, which was completely unexpected, but it really helped me prepare and have a positive labor and delivery experience. So for those of you who are pregnant and are looking to mentally prepare, I hope this video helps you guys out. I will be releasing a birth video soon, and for now I hope that this video has been really useful for you guys. If you have liked my video today, don't forget to hit the like button and subscribe to my channel if you're new. Hope to see you guys in my next video real soon. Till then, bye!